This is breaking news.
Remains such a key part of our public health infrastructure in the state as the entity that will be distributing vaccines and, of course, educating the public. We're doing all of this with real attention to the importance of dignity and respect, without stigma, and with equity always at the center of our work. So you can see the case update on the slide. Already, the CDC has reported something over 2,100 cases as of yesterday nationwide. The actual number is 2,108. And New York State has 69 of those cases, 639 in the city. Almost all of the other cases diagnosed in the state, 40 of them, are located in the downstate area. But yesterday, we had a case diagnosed in Tompkins and in Albany counties. So we expect the number of cases to increase. This reflects both increased diagnostic and ascertainment, and it reflects ongoing transmission within communities. I'm going to take a moment just to remind everybody about monkeypox as a clinical syndrome. It is rarely fatal, but it is extremely unpleasant, and the lesions can be severely painful. And also they're scarring lesions. As they heal, they will leave scars. So this is something that nobody wants to get, but there have been no deaths reported in the United States. The other thing to be aware of is that we have to await the rash to make a definitive diagnosis. So once the rash emerges and that pustule forms, we can do a swab and test it for virus. At this time, there is no other way to diagnose monkeypox save swabbing a pustule. But people may feel symptoms and feel unwell before the rash appears, and we want people to be alert to flu-like symptoms, swollen lymph nodes, and of course, if you get a rash, you should seek attention if you're concerned about monkeypox. In this outbreak, rashes have not always been generalized as they are classically. They've occurred on or in the mouth, in the genital area, in the perianal area. So they have been more localized than we've seen. That once you have symptoms, these can last for 2 to 4 weeks. As long as you have a healing rash, you are contagious. You have to wait until all of the pustules have scabbed, the scab peeled off with healthy skin beneath before we can be confident. This can take 2 to 4 weeks. All right, let me just say again that anyone can get monkeypox, but in the current outbreak, monkeypox is primarily spreading through the social networks of gay, bisexual, and men who have sex with men, and it spreads through prolonged skin-to-skin, face-to-face contact, the kind of contact that people have during sex or other intimate activities. It's important for New Yorkers to protect themselves, the people they love, their friends, their community, and it's important to ask sexual partners whether they have a rash or symptoms that are consistent with monkeypox, and to avoid skin-to-skin, face-to-face contact if you have a rash or if you are having intimate relations with somebody who has a rash. Consider the level of risk in clubs, raves, saunas, parties, other places where people are having contact with multiple individuals, and consider these to be high-risk situations. Again, consult a healthcare provider and follow provider recommendations for testing. I'll reiterate that the testing does depend on a lesion. All of us wish that there were a rapid test, as there is for COVID, but there is no test like that at this time. We have in the state 2 outstanding public health labs. The Wadsworth Center is able to process about 240 specimens a day. We continue to have capacity. We have no backlog of untested specimens. And as I've mentioned, we now have commercial labs bringing on board I misspoke. The same people who are responding to monkeypox are also working hard on COVID, which we'll turn to in a moment. I also just want to say a word about treatment. Treatment, there are antivirals available for treatment, but for most people, the treatment will be symptomatic. It's aimed at reducing symptoms, keeping that rash clean, dry, protecting against additional possibly bacterial infections, avoiding sun exposure, taking time to go to a healthcare provider to talk about over-the-counter remedies like calamine lotion and other topical aspects that can help with the itch of the rash, and also things like lidocaine jelly that can help with the pain of the rash. Over-the-counter stool softeners may help with the pain in perianal area. The vaccines is the next thing that I'll turn to now. Because of a limited supply, our eligibility criteria continue to be based on people at highest risk of exposure or people who have been exposed to monkeypox. And that includes individuals who've been exposed in the last 14 days and those at risk of recent exposure to monkeypox. That includes members of the gay, bisexual, transgender, gender nonconforming communities and other communities of men who have sex with men. The window for contact is the last 14 days. And people who've had skin-to-skin contact in a network where monkeypox transmission is ongoing are also eligible. We are distributing this supply through local health departments who are using a variety of strategies to ensure the vaccine is made available and that it is made available in an equitable fashion. We do not, at this time, have vaccine to provide vaccination to everybody who wants or needs a vaccine. We continue to advocate for more vaccine from the federal government, and in this we have this active support of our governor. On the slide here, you can see the website where you can get more information about monkeypox, and we have a texting program that people can enroll in, either in English or in Spanish. And you can see there the text number is monkeypox to 81336. So with that, let me thank you, and back to you, Governor.
Thank you, Dr. Bassett, for the very thorough, as expected, a necessary conversation about the reality of what monkeypox is all about, how it's spreading. The numbers are continuing to go up, and we need to be transparent and communicate as openly as possible with the public about how it's transmitted, what the remedies are, and how we're working really hard to be able to secure more doses to protect everyone. But at this point, I'd like to bring in someone who's been in regular communication with us, and I want to thank Dr. Ashish Shah, who's the White House coordinator on COVID, but we also have been having many conversations about what you are doing on the monkeypox distribution. We've talked about our numbers and our cases in New York, and I really just want to thank you for your willingness to look at the normal distribution based on population, but also recognizing that we have at least a quarter, if not a third, of the cases in the country here in New York State. So, Dr. Jha, thank you very much for joining us today.
Yeah, Governor Hochul, thank you, and thank you for your extraordinary leadership and partnership here. And always a pleasure to also follow Dr. Bassett, who's one of our nation's preeminent public health experts. So we've got a great team, and this has, I think, been a really good partnership on our end, and we are just grateful for that. I'm going to take just 2-3 minutes. I'm going to spend a minute talking about COVID, because it's still with us. We have a set of challenges that we all have to manage, and then I will talk about monkeypox. Both recap some of what we're seeing at the national level, as well as what we expect in the days and weeks ahead. In terms of COVID, as many of you might have heard me talk about right now, the challenge that's facing us is BA.5. This is a subvariant of Omicron. It is now the dominant variant in the United States. About 70–80% of all cases are BA.5. And the reason it has us concerned is because it's incredibly immune evasive. People who were infected 3 months ago, we're seeing high levels of reinfections. People who have not been boosted for a while, have not gotten a vaccine shot in a while, we're seeing a lot of breakthrough infections. But the key message that I want to make sure everybody understands is that the key tools that we have developed over the last 18 months, vaccines, treatments, our diagnostic tests, they continue to work against BA.5. And probably the most important message on COVID that I want to get across today is if you are over 50 years of age, and if you've not gotten a COVID shot this year, if you've not gotten a vaccine this year in the year 2022, you need to go out and get one now. It will offer a very high degree of protection, keep you out of the hospital, and will get you through the rest of the summer into fall. And we do expect in the fall, we will have a new generation of vaccines that are Omicron specific. Getting vaccinated right now will not make you ineligible for that. Very, very important. Everyone over 50, if you've not gotten a shot in the last 6 months, please go out and get one. And as I said, the other part is our treatments are continuing to work. If you're over 50, if you have any high risk conditions, if you have a breakthrough infection, get treated. New York has been one of the national leaders on setting up easy access to treatments through test to treat sites, a whole set of ways that New York is really leading the country. But the goal is, in partnership, the federal government, your state government, working very closely to make treatments as easily available and as widely available as possible. So those are my key messages on COVID. Let me now turn to monkeypox. And again, Governor, this has been, as these things always are, a very close partnership, and I really appreciate your leadership, Mayor Adams, in both advocating for New York, as well as making sure that we're all aligned and focused on trying to get the limited supply of vaccines we have to the people who need it most. So I want to just talk a little bit about vaccinations and where that is. Just a couple of weeks ago, there were about 10,000 doses out into the community. That number has grown exponentially, where over 100,000 doses have been administered. Just last week, as the governor said, we announced another 131,000 doses allocated. Of that, New York, as a state, got about 33,000 doses, a little more than 25%, and appropriately so. As you heard, the outbreak, it's happening in many places across the country, but certainly New York has a substantial share of the outbreak, a substantial number of cases, and New York absolutely needs and deserves those doses. And right now, based on all the allocations we have given out, a total of about 65,000 doses of vaccines allocated to New York so far. That, by the way, just to give you a perspective, that's enough vaccines for the first shot for about 50% of the population at risk. We're talking about people living with HIV. We're talking about men who have sex with men who are eligible for PrEP. And that's progress, not enough. We got to keep going and we got to keep doing more. So let me just talk to you a little bit about what people should be expecting in the days and weeks ahead. There are about 800,000, a little less, I think about 780,000 doses that were filled and finished in Denmark. FDA inspectors have went and did inspections in Denmark, are back. Those doses are coming over to the United States. We expect about half of those doses to be in the United States this week over the next few days. The rest of it coming next week. FDA inspectors, FDA scientists are running some integrity checks, making sure the vaccines are in good shape. You know, I know everybody wants to move very quickly on this. FDA really is a gold standard. We want to assure safety of these vaccines. They are moving about as fast as possible to get all of that kind of safety checks done. And we're expecting early next week to get a thumbs up from the FDA, assuming everything goes well, and I don't want to prejudge that, but assuming everything goes well. That means another 760,000 doses nationally become available. My hope is over the next few days, we'll be able to make allocations, again, disproportionately giving vaccines to places where the outbreaks are the biggest. But in the days and weeks ahead, you're going to just see more and more vaccines become available. And obviously, after that 760,000 doses, we're not going to be done. We're continuing to work with the one company in the world that makes the Jynneos vaccine to try to get more vaccines produced, both there and in the United States, and with the goal of more and more vaccines becoming available. Let me just finish with the last point. Vaccines are only one part of the three-part attempt here. We got to also make sure diagnostic tests are becoming easier to use. You heard from Dr. Bassett. Got great state labs, arguably among the best state labs in the country, are in New York. We're also making commercial labs available, making sure that that's easy to access. And we're doing a lot to make sure that treatments are also becoming easier and easier for doctors to get. So this is a tripartite, sort of a three-pronged approach. But one thing that's always been very clear to us is there's only so much we can do here in the federal government. Public health works best in America when it's a tight partnership between states and the federal government, and we could not be happier here in the White House. with the partnership we have with Governor Hochul, with Dr. Bassett, Mayor Adams, Dr. Bassan, the entire New York team. So thank you for that, and thanks for letting me spend a few minutes with you.
All right. Dr. Jha, thank you so much. We appreciate the attention you've been giving us after we've had many conversations, and I know you know our concerns, and that help is on the way, correct?
Absolutely.
All right. Thank you, Dr. Jha. Have a great day.
Thank you.
All right. Now for the topic of the day, COVID. There's so much going on. We have a lot to cover, but it's another chance to take a look at what we talked about, the emergence of BA.5. And so I wanted to give New Yorkers an update of where we're at. And as much as it's phenomenally hot outside, in fact, before we're done today, I'll give you a heat update, weather update. Fall is rapidly approaching. And as we've seen from past trends, this is now our third season heading into fall after seeing numbers decline late spring and in the summertime. Fall is quickly approaching. We're watching the numbers, but people start heading indoors. It gets colder, and kids are heading back to school. So we've been doing intensely, having many, many meetings internally to prepare for the future, but the future is right around the corner starting this fall. So like I said, we've seen cases before. Look at the numbers of, this is the history. This is what we're very cognizant of in what happened in 2020, in 2021, and what could be happening now, the number of cases that start spiking up this time of year. So that means it's time to be prepared. We need to make sure that we look at the cases. You can see our spike that went up because of Omicron in the wintertime. We got through that, but if you look at June 20th, July 16th, trending upwards a little bit. We're at 37 cases per 100,000. Last week was 35. A month ago was 24. So not a serious spike, but when you compare to Omicron, you talk about we were at 37. We were at 381 cases per 100,000 at that time. But we've seen the past, and the past can become the present if we don't take the steps necessary now. Again, look at the July 16th numbers, just a little creep up there. New York City being one of the, been the highest right now. Hospitalizations, this is what we watch at Hawk. We lost 22 New Yorkers yesterday, individuals who, succumbed to this illness. So it is still real. It is still dangerous. And, we are looking at hospitalizations trending upwards. A month ago it was about 9 per 100,000. Today it's 12, almost 13 per 100,000. Omicron was 62 per 100,000. So we're not there, but we need to be cognizant of what could be our future. So these are our hospitalizations, our trends. You see at the bottom, they are absolutely trending upward. So vaccinations are the key. We've talked about this a lot. We still are proud that we have, we're number one in the nation for having the adults fully vaccinated, number one for teenagers fully vaccinated, and number two in the nation for children 5 to 11 fully vaccinated. But we can do better. These are numbers I want to put in front of the public once again to say, where are you? It's time. They're readily available. No scarcity, no lines, no hassles. There is no excuse. So Dr. Jha also talked about the importance of boosters, as did Dr. Bassett, we talk about this often. The booster right now, the second booster is only approved for people who are 50 and over and 12 years old who have an weakened immune system. We are pushing the federal government to expand this. We think we're going to get some information soon because we believe that this should happen, and New York State stands ready to get the additional boosters out the door. And again, there's no shortage. It's just we're waiting for the law to catch up with what we're dealing with here. So those are our number. Over 9 million people have been received boosters, but we have more to do as well. So let's talk about the future. That's where we are today. If anything, this pandemic and COVID has taught us, preparations are the key to literally survival. And when I came into office last fall, we rolled out a plan to deal with schools and a smooth plan to have schools reopen. And then all of a sudden we got slammed with Omicron, and we saw a very serious crisis at the time. So I wanted to sit down with my team now and develop two plans. One is in the short term. That is our fall action plan to prepare for fall and winter this year. And for the long term, what we're calling our pandemic after action review. So let me start with the fall planning, which is now underway. Yes, this looks like a military operation. This is what we operate under with our very, very regular meetings to talk about all the points that we need to be assessing and examining our response and our preparation. It is militaristic in how we do this, but we're serious. We're very serious and intentional about how we're going to deal with this pandemic because it is trending upward and we expect it to continue to increase. So that's sort of our map, but let me walk you through some of those elements of it. Unlike a year ago, we have far more tools at our disposal between availability of tests and vaccines and treatments, the boosters, and again, our goal has been to remove any barriers to people receiving these goals, make sure they know the availability, make sure the doctor's offices know, and also looking at the overall strategy. We will be talking about our return to school strategy, getting more New Yorkers vaccinated and boosted, testing early, testing often, more access to treatment and therapeutics. Also stockpiling, yes, once again, having to stockpile PPE, strengthening our hospital systems that really were under such stress. And I'll talk about what we're doing there as well as coordinating with our partners. But also something else. I wanted to hear directly from New Yorkers on how they're feeling about what's going on and how they're adapting to the new normal. So we listened to them. We conducted a survey just last month, and I just want to highlight some of the key findings. And most New Yorkers feel things have gotten better. They currently feel safe about the state of COVID. About 90% feel somewhere between neutral to very safe. And about 75% still believe in the ability of vaccines to prevent transmission. That's important to us. People know about antivirals, but they don't know how to access them. 70% know that the antivirals are available. And also 80 to 90% of New Yorkers have said that they have no trouble accessing at-home tests and PCR tests. But people who are uninsured, we knew this could happen, are having a hard time accessing the PCR tests. About 40% think they don't have them available to them. So we have provided more information about eligibility and effectiveness around people over 65. They're willing to do so if they're provided more information. So we're focusing on that place where we are, just sort of a snapshot in time of what it's been like after 2 years. But let's talk about our return to school strategy and how that is critically important, because as we start venturing into back to school shopping and getting supplies and thinking about that return. I know it's only midsummer, but we have the luxury now of time to prepare for the inevitability, which is parents and teachers being anxious about going back into the classroom again. So parents, we have a return to school strategy once again, and we're going to make sure kids are safe and protected. So here's what we're proposing. We are now distributing, as we speak, over 3 million test kits to school districts to make sure that every student and member of their staff can test before the first day. We encourage everybody to take advantage of this. We did this last year. I was only in office starting August 24th. Start of school was literally the next week, so we had an emergency crisis where we were trying very, very hard to protect kids in schools and getting information and vaccines and everything out there. But we're in a different place this year. We have the time to say, okay, what has to happen? Direct communication with our school districts is key, telling them these are coming. We are making sure that we can have the tests available to schools, which is why we've been amassing so many test kits. Right now, everybody's going to ask about, are kids going to need tests or masks in schools? This was a big issue last year. Right now, we're saying they don't. That we don't currently, based on today's numbers, anticipate the need for masks in classrooms, but I'm going to reserve the right to return to this policy if the numbers change, the circumstances change, and the severity of the illnesses change. So God forbid there is a variant that affects kids more severely. We've seen a lot through this crisis. I feel like we've seen everything, but maybe we haven't. And that's what we're preparing for. So my number one job is to protect the health of New Yorkers, especially our vulnerable children. And if we learned anything, we know that kids need to be in school. One of the biggest takeaways that we'll be talking about in our analysis, the effect on children not being in a cool school setting, and we're still dealing with the aftermath today. So it is our objective, ensuring the safety of our students, but that they be in classroom for in-person learning this fall once again. Next part of the strategy, more vaccinations and boosters. 99% of residents live within a drivable distance to a vaccine provider. That's extraordinary. A year ago, we would have just thought that's never going to happen, or even 6 months ago. So a lot of work has been behind this. We have a provider network that we can take care of boosting all residents over 65 in a short time. We know how to do this. We know how to do these operations now. And also, we're just assessing our overall infrastructure. Are there shortcomings? Are there parts of the state? Are there buildings and congregate settings in place where people have vulnerabilities? We also know we can stand up mass vac sites like this if we have to. We know what to do, and that gives us some comfort, and we're prepared. If we see the numbers, something changes. And again, we don't always know that we can count on the federal government to send in the cavalry. We don't know that they'll be there with the money that they had been in the past. We don't know that they'll be there with the resources. So this is ensuring that we can be independent and take care of our residents. Also, a part of our strategy is to continue with the testing. And what we did, and I'll never forget these dates because it was November 26th, because we're doing a lot of holiday briefings around Thanksgiving and Christmas Eve and New Year's Eve. I think a lot of you may recall that. We saw that the spike in Omicron went from being just named on November 26th, our first case around December 1st or 2nd in New York, and all of a sudden the numbers were off the charts. And that was right when we were talking about kids being home for the holidays, gathering with all their relatives, super spreader events around the holidays, and then kids returning to school shortly thereafter. So what we did in a very intense way, really a crisis situation, we had to amass as many test kits as we could, because if we didn't have them, we were not going to be able to send kids back to school. So we were so aggressive in this, and I'm proud of what we did. We talked about this at all of our briefings, our daily meetings, how we could amass over 100 million test kits so we could open schools and keep our prisons safe, our nursing homes safe, and make sure that there was no shortage of test kits once they became available. And we had more than any state. I think that at one time we probably had more than the federal government, because people were calling us. Other states were calling us, asking if they could borrow some of ours, because we jumped on this immediately to make sure that we could never have to say no to anyone who needed tests done here in the state of New York. So right now we have a remaining stockpile of about 20 million, and that's dedicated toward our fall effort to protect the kids in schools. There's 2.6 million children in schools, plus support staff and teachers. So we're going to get the 3 million out right away, but then we'll have enough. But also, so we had that emergency situation. We had to do a lot of ordering, short time frame. But now, because we have the benefit of time and analysis and projected trends, we have an RFP out in the field right now to help ensure the continuous supply of tests. So that's being back soon, Jackie Ray?
Yeah, the plan is to have tests in hand from that by the fall.
Okay, so we have enough, but we also have to anticipate a challenging fall once again, and the tests have been extraordinary. The availability of them is just, I guarantee, has stopped the spread when so many people can just test early, myself included. Make sure that we adapt our behaviors. We stay home if you test positive at home. So we also have massive capacity in our labs so that we can do over 500,000 PCR tests every single day if necessary. We're working with our local health departments in a way that they know that we count on them as real allies. So if we need to reactivate any local test sites, we will be able to pull this off as well. Access to treatment and therapeutics, that's our next step. We have 44 test to treat sites, but also, as I mentioned, a lot of people know there's therapeutics out there. They don't know how to get them, which is why we put forth this treatment hotline. Literally, you can call this number, speak to a practitioner, and be able to and get the treatment. That was not the case before we put up this phone number, so we want people to take advantage of that. And about 40% of our pharmacies receive a direct supply of therapeutics from the federal government. So that's an important part of what we're doing. So let's get people, this hotline we just literally launched about a week ago. Just want to give you some numbers from our 1-week-old hotline to call for treatments. We've had 275 calls. We had 198 clinical assessments, and we had 131 doses of antivirals prescribed, again, to people who did not have access to their own practitioner. So please call for help if you need anything. We're there to help and make sure that you are not left without the treatments you may need. And also, we cannot forget the effects of long COVID. There are still people hit so early during the pandemic who have that loss of energy and feel that their senses are not what they used to be. And just a lot of, it affects everybody so differently. Earlier this year, Department of Health, we talked about engaging a discussion with researchers and clinicians and scientists and how we deal with long COVID and help advance research toward a treatment. And just to have people take this seriously and recognize that these are real. And it's a huge source of anxiety for people who are dealing with this, but they need to know we hear them, we understand what they're going through, and we're going to be there to help them as we approach the future. I mentioned stockpiling. Didn't think we'd have to do it, but I'm not going to be caught off guard here in the state of New York. We're going to make sure that we have over 60 days worth. We have, as I mentioned, 20 million at-home tests, but also our PPE is going to be there heading into the fall. Strengthening our hospital systems. This is a topic of another whole conversation. It is a fact that our hospital systems, many places, were overwhelmed. We had different spikes in different parts of the state. Even, as late as this spring, we were setting in the National Guard. It seems like a long time ago. This winter in the spring, we had National Guard going into hospitals and nursing homes to help with the shortage of workers to help people heal and get better from not just COVID, but from whatever they're in the hospital for. So huge lesson we learned was to make sure that we have enough beds and resources available. And so we're continuing to keep our surge operations center open where we can deploy people to different parts of the state. We don't want to shut this down. We don't want to remove any authority we need to make these decisions. We don't want to take our foot off the pedal because we know from the slide you saw earlier that the trend is that the numbers will go up. So that's what this has been all about. And it says on top of that, we investing over $20 billion to help our whole healthcare economy overall. Raise the workers' pay, get them to stop leaving, improving infrastructure, and incentives for more people to want to join the workforce. And as I mentioned, continuing our surge operations. And we have staffing contracts that we're going to keep in place that we can reactivate people with 5 days' notice. That is a tremendous savings of time when you're in an emergency situation you want to be able to take advantage of. So we need that flexibility. We still have that flexibility. We're not ceding that flexibility as long as we're still in this environment. And I look forward to the day when we don't need to have those concerns, but also coordinating with our federal partners. We have a deep relationship with the White House, which is great. Dr. Jha and others who are continue to work closely with us. So those conversations are ongoing. So that's our fall plan. A lot of time and energy going into all the different buckets. So everybody should have their own fall action plan. Stay updated on your vaccine and booster doses. Test often. I keep test kits by my bed just in case. When I was off to see my grandbaby, I was going to be tested before I went and saw her. Everything's good. And just talk to, if you test positive, talk to your healthcare provider or call our hotline, and we'll be able to help you out there as well. So I mentioned that's the current operations. That's very much underway. Let's talk about the aftermath of what we've been going through already. As much as I'd love to stand, I thought we'd be able to launch this when the pandemic is gone. It is becoming clear to me that it's not gone, so we're not going to wait any longer to start some analysis. And so since March, we've been talking about this in anticipation of a day when this will be beyond us. But I want to start moving ahead right now. So we're going to have a pandemic after action review. We're not required to do it. It's not mandated by law, but it is something I feel is important because New Yorkers deserve the best from their government. They need to identify what worked and what did not work and why. And I believe it can not just be a guide for future leaders in the state of New York, but also for other states as we respond to not just COVID, but to future emergencies, because we had to deploy all the resources of state government. We have been doing so continuously. And how is that going to function under different circumstances, different emergencies, and best practices, and also decisions that you would not want to make again in the future. So no state has done this. We'll be the first in the nation, and we do hope that this can be a blueprint for others to follow. So today, I'm pleased to announce that we are posting a request for proposals, RFPs, to continue moving this after-action review forward. Specifically to review our COVID response, identify strengths, best practices, as well as deficiencies, provide key recommendations, and prepare a planning guide for the state to use in future emergencies. So this is going to be an important resource for us. It's not going to be done overnight. It's going to take a fair amount of time, but we're going to get it right. We're going to be covering policies related to medical procedures and hospitals and patient facilities, the transfer of individuals, vulnerable populations into congregate settings, homeless shelters, group homes, nursing homes, jails, prisons, and how efficient the infection controls are in those settings. That's very important to us. as well as the impact on early childhood and school-age children and special ed and post-education programs, and talk about the shutdown and the reopening of schools and how to handle that in the future, as well as the shutting down of the economy. We had a lot of areas affected, and so I want to make sure that we are very intentional about this, that we have a broad scope to what we're doing, but also to have a real blueprint so that is useful to us, does not sit on a shelf, but can be something that we can employ day after day as we deal with the day-to-day crises, but also going forward. And also look at what some of the benefits are that, based on what we saw people rise up and do. The whole future of remote work and areas of telehealth services are a lot of good things that came as a result of the pandemic. So we're going to determine also factors that were used to determine which businesses and industries are considered essential and for what purposes, as well as how we secure essential goods and services to meet New Yorkers. The food supply that was disrupted, the supply of PPE and protection needed for workers. So we're going to also talk about the coordination between the federal government and other localities, counties and cities, and making sure that communication is always tight. Communication with the public is important. We're going to be how data was shared, and all the staffing and expertise required to implement these emergency procedures. So this will be a one-year contract. I've asked for initial findings in 6 months to make sure everything's on track, and we expect to be able to present a review within a year, because this is going to be thorough. This is for the ages. This is something that we're going to continue to rely upon, again, through other crises, to make sure that we are operating at the top of our game, in a sense, that there are no areas that we would leave untapped or areas that need remedy that are not fixed going forward. So these are some of the areas we're going to be focused on. And again, it's not going to conflict with other ongoing reviews. That's important. But what I want to do is look at, not interfere with other inquiries that are going on, but look at what I have the authority to do, and in my capacity as the state's top executive. So I authorized a look back for us to examine what happened in the past, but the whole purpose is to look toward an eye toward the future and how we prepare for that, and making sure that we are independently running this. So to oversee this process, I'm going to announce that Jackie Bray, our Commissioner, Homeland Security and Emergency Services, will be involved. She was a key member of the team starting right around when Omicron started, or around that time. So she was brilliant in her execution of what we had to do. She's responsible for finding the way that we got those 100 million tests when we needed them. I want to thank her for that effort. But it's also going to be important to me that independent entities are selected. The RFP specifically says that any consulting firm that was involved in advising during the pandemic would be not included, because we want to make sure that there's complete independence as well here as well. So that's what we're working on. We're very much looking forward to starting that process. I believe it's an important one. Again, we had thought it would start when the pandemic was completely in the rearview mirror, but that's not going to happen anytime soon. So now is the right time to go forth with those preparations. But before we wrap up, cannot ignore the fact that we're going through extreme heat wave, and so that's what we're looking at. This is the state of New York as of hours ago. Jackie Bray, when she's not worrying about COVID response and now managing the comprehensive scale of our after-action report, she gets these on her desk about every few minutes or so. They keep updating it. So we're going to have extreme heat throughout the state, possibly going into over 100 degrees. And so just to let you know what we're focused on, we are working with DISH's, Jackie's agency, to monitor weather conditions, coordinating our response. We are also, and this is really important, in constant communication with the utilities. Can they handle the capacity? What this is going to do for the effect on the loads, and working sure that they're able to manage the need for increased capacity as people continue to keep their air conditioners running and try to escape the heat. Also, we're monitoring air quality. We're going to continue, if necessary, issuing air quality advisories if we need to. So again, we'll do what we can on the state end. But avoid going out in the peak hours, stay out of it, stay hydrated, keep your pets inside, check on your neighbors, and be aware of any other induced illnesses. So just look out for everybody. But if you have anybody who needs help, make sure you get hold of our Office of Temporary Assistance, and also keep track of our local weather forecasts. And so that was a lot today, a lot going on, but it's important. Communication with the public through the media, and I appreciate those of you came through the heat. I guarantee it's going to be a little bit hotter when you leave the room since this went on a long time, but I appreciate you being here. It's really important that we have this two-way communication to get out to the residents, but I have the dream team here to answer any specific questions on